Hi, I am Dr. Sourav Santra, retinal surgeon at Disha Eye Hospitals. Today in this video I am going to talk about macular hole. So macula is the central part of the retina and retina is the innermost layer inside the eyeball. So when light falls onto the retina, it travels through the optic nerve into the brain and then brain projects an image that we see. So any defect at the center of the retina or macula can lead to decreased vision. Macular hole is a condition that usually develops inside the eye after 55 to 60 years of age. With aging, the gel inside the eye, which is also known as the vitreous, begins to liquefy and it separates from the retina. If this separation between the vitreous and the retina is abnormal or incomplete at the center of the retina, it can lead to macular hole. Initially, the patients complain of blurred and distorted vision with reading difficulties, but as the hole grows in size, the central vision progressively worsens and the patients see a black spot at the center of the vision. If the holes are small in size, we can observe the patient and keep the patients on close follow-up, but in majority of the patients, they need surgery. Macular hole surgery is done under local anesthesia. It is a very delicate surgery done with the finest of instruments and best of technologies, and that's why the post-operative healing is also very fast. We remove the vitreous inside the eye to get to the hole and peel the innermost layer of the retina and replace the vitreous cavity by an gas. This gas remains inside the eye for 2 to 3 weeks. Visual outcome after surgery depends on the duration of the macular hole. So sooner this condition is detected and treated, the post-operative visual outcome is better. If you have any queries, please leave your queries in the comment section below or contact the hospital helpline number. If anyone is suffering from any retinal diseases, please visit a retina specialist immediately. Thank you.